Our Center of Excellence is primarily clinical research, if you will, but we're now coupling that with the future of clubfoot treatment, and that is going to be through genetic information that we are able to interpret a little bit better than we can today.
You're such a good boy today.
All of my colleagues here work with some clubfeet babies. We're all contributors to our Clubfoot Center of Excellence. We give a very good general clinical picture for clubfoot treatment. It's just not one person, it's just not one expert who's deemed to do it, but it's all of our colleagues at the institution.
Wow, looks very good.
My clubfoot patients are treated in my plaster clinics, and so I will see children beginning at a few days of life. Each week the child comes in for 6 weeks and we manipulate that foot and bring the foot straighter and straighter and straighter and then up and up until we finally get to the foot in a position that's functional, a fully corrected position.
Once their care has been completed in the clinic, they go down to our orthotics department.
Okay, that looks pretty good.
We use temperature sensor monitors in the little clubfoot shoes and bars that we utilize after the treatment in order for us to be more objectively accurate in assessing how compliant families are with wearing the shoes afterwards. The reason we did that is to try to determine, will the outcomes be affected by how compliant families truly are in wearing their braces?
Well, I always have to sort of grade the appearance of the foot and sort of grade the effort of the parents to sort of give you an A+. Is that okay?
That sounds awesome.
A lot of the clinical research is with my colleagues on the medical staff here, in which we look at the outcomes of the patients who we treat with club feet and determine how successful our programs are with non-operative treatment or for those who need to have surgery. And we determine their strength and their function through a number of evaluations through our movement science lab. And these opportunities give us a lot of reporting to our colleagues throughout the country to determine how we're moving forward with club feet.
We have an ongoing clubfoot project that has been active for coming up on 16 years now. We started when these children were 2 years old. For years and years in clubfoot, we operated on nearly every foot that we treated. With the adoption of the Ponseti program and the French physical therapy program, we operate very seldom on club feet.
Caleb was born with clubfoot, and I didn't know what it was at the time and was horrified as a parent. And one day my husband and I were sitting at home and he was watching Fox 4 News here in Dallas, and it was giving information about clubfoot and how important it was to get the baby in as soon after birth as possible. He called me and, Savitra, you need to come see this. This is our baby's foot. From there, I called his pediatrician and we got an appointment at Rite, and at 2 weeks old, he was here, and that was our journey to getting him looking normal.
I would tell you that clinical care and research are intimately intertwined. We've come a long way in the last 2 decades in our treatment of clubfoot to become much less aggressive. It's through a significant amount of the work that we've done with the Clubfoot Center of Excellence that allows us to sort of develop that further and become even more successful.
I couldn't have asked for a better result. Initially, you know, as a parent, you want everything perfect on your child, and I was thinking about handicap stickers and him not being able to play football and him being teased, just a lot of things because his foot looked so different and it was turned and twisted. But I'm so excited that very early on I got the relief that that would not be the case.